name is Priti Vohra. I am an interventional physiatrist. I did residency in Physical Medicine Rehabilitation and an interventional fellowship in spine, sports, and pain management. Very early on, I looked at function when I was treating patients and seeing patients. Then when I chose my specialty, I took that into consideration and I picked physical medicine and rehabilitation because it was all about the body rehabbing itself and your physical body. As I was going through my residency, it was very rewarding, but I reached a point where there was just so much you could do to help a patient, and I kind of hit a wall many a time. And so I decided to go even further into specialty training, where I did an interventional fellowship, where I learned very advanced interventional techniques to help patients with their pain and their function, and in addressing their individual body parts to really get them back to functioning, give them their quality of life back, and just get them back to living life. So with chronic pain, it doesn't just affect your specific body parts, but it affects your entire life as a whole. It affects you mentally, it affects you at work, it affects you in your home life. So it's so important to try to combat that pain early on to help prevent it from becoming a lifelong issue. I usually start with a simple rehabilitation of some type, whether that's physical therapy or chiropractic treatment. So I work in conjunction with them quite a bit, and together, just the collaboration between myself and therapists can take a patient very far. That can help many a patient, but then there's the few that it won't fully work for. And then I work hand in hand with my other colleagues here at Florida Surgery, like the orthopedic surgeons or the neurosurgeons, and we work in conjunction together to see what the best plan of care would be for that patient. There was a young kid, actually, he was probably 20, because he was a college athlete, and he was on a scholarship for soccer. And he was very distraught when he came to my office because he was unable to play, and that was his life. He loved soccer, he loved playing, and also it affected his economics at college. He needed his scholarship. So he came in with his mother, actually, at the time, and he was in a lot of pain. He was unable to walk, he was unable to barely move. We did all the necessary testing, and then we did the treatment. And by the 3rd month, he was back to living his best life. He was playing, he was enjoying college life, and it was just such a wonderful experience to see him from day 1 to the 3rd month. So the best part is how rewarding it is when you see a patient's function completely change from bad to good, and when you can see that the pain that was affecting their entire life, again, not just their physical function, but also their home life, work life, everything has kind of been remedied.